Hi, everyone, and welcome to Your Health Now. My name's Laura. I'm a clinical nurse specialist and credentialed diabetes educator.
And I'm Merryn, an endocrinologist and general physician.
So today we're going to be discussing male sexual health, and Marin's going to start.
So this is a really big topic, actually, and one I think that is not often talked about. And I know that when I see men and ask this question, they often say to me, "Oh, you know what? No one's asked me about this, or I've not really talked about this before." And so I think it really needs to be talked about openly, and there's a lot of help that can be provided to anyone, whether they're male or female, with sexual function issues. But certainly in men, we need to talk about this more and have that conversation and help with any of those issues. So I think the big question probably is how common is this? And what we know is that around about 16% of men, so all men, will have sexual function issues at some point in time. And it's more common in older men and more common in men who have any health conditions. So in the younger men, in their kind of up to the 20s, really, it's about 8% of men. But in men, moving up into their 40s, 50s, it's more like 37%, so getting up to the 40%. So it's quite a common issue, over a third of men, so more than 1 in 3 in those older age groups, are having sexual function issues.
which is quite astounding when it's usually the first time that they've been asked.
That's exactly
You
right.
know,
Yeah,
in one of our consults. So
that's right.
I think it's one of the reasons why we wanted to make sure that we made this video today.
That's right. And if you think about even younger men, there being 1 in 10 in the younger age population having issues, that's really something that needs to be addressed, all through the different age groups. So the question then is, why? So
Well, what are the causes?
exactly, why do men have sexual function issues? And for men, there are still some psychological and psychosocial issues, but we see those more commonly in women's sexual function. For men, there's a lot more physical, medical kind of issues. So what we know is that men who are healthy, so men who are active, eating well and sleeping well, are less likely to have any sexual function issues. But as soon as men start to gain weight or
Decrease activity.
absolutely, they're less active, they're not eating as well, then that certainly increases the risk for sexual dysfunction. And we know too that sleep, and in particular sleep disorders such as sleep apnea, so men who are snoring and if they stop breathing when they're snoring, that reduces oxygen to the brain. That can affect testosterone levels, but it can also independently affect sexual function in spite of testosterone. Men with restless leg syndrome at night, and men not getting enough sleep, obviously. And, I think this is something we see a lot in women as well, but certainly sleep issues. So, we need to ensure that we're looking at lifestyle issues in men and keeping them as healthy as possible so that their sexual function can be optimal. There are also medications. So there's quite a lot of medications that can affect sexual function in men, and one of the most common is antidepressant or anti-anxiety medications. So a lot of them can affect sexual function, and if you are taking these medications, it's worth speaking with your health practitioner about some of those that perhaps have a lower side effect profile in relation to sexual function, because they're not all going to cause the same amount of issue, and some won't cause an issue at all. Other medications would be blood pressure or heart tablets, and in particular beta blockers, so things like metoprolol, atenolol, those kind of medications, or alpha blockers, and these can be used for prostate problems as well, so like prazosin, mini-press, those kind of medications.
And how would those medications affect, an erection or lack thereof?
Yeah, so in a lot of men, these medications will decrease the hardness of an erection. So they may still be getting erections, but they may not be as hard. But they can also decrease the frequency of erection or take them away altogether. And probably one of the questions that we always ask men when we're exploring sexual function is, are you still getting morning erections, or are you getting erections in the night? Because those are a very good marker of sexual function and sexual health. So if for some reason you start to notice you're not waking up with an erection, and this actually doesn't have to do with a full bladder. So there's a bit of a myth that if you have an erection in the morning, it's because you have a full bladder. That's not actually the case. It's a very good independent marker of sexual function and not whether or not you have a full bladder. So that's something that that might alert you to the fact that there's an issue. So, pretty well medications. The other medications are diuretics, so fluid tablets such as thiazide diuretics or spironolactone as well. So there are psychological factors, lifestyle factors, medication. Then there are these health conditions, and we've talked about sleep apnea, but other conditions such as diabetes or heart disease or any other condition that affects blood vessels or nerves in the body can affect your sexual function, and that's really important. Hormonal issues, so low testosterone is another big one, and it won't surprise people to know that if you're not getting enough oxygen to your brain because you've got sleep apnea, then it's difficult for your pituitary gland to produce the hormones that stimulate testosterone. And so there's that link there as well. So they're probably the common causes. So good health equals good sexual function. Obviously, there's other things like alcohol, drugs, those can adversely affect sexual function as well. So we've got to be careful about those. And smoking, tobacco addiction can affect, the caliber of blood vessels and those kind of things too. So they're all really important factors. Yeah.
And so how do we treat sexual dysfunction in men?
So the first thing is men asking for assistance or healthcare practitioners asking men,
initiating the conversation
exactly about sexual health. And I think to anyone who cares for a man in some way, whether it's your husband, friend, partner, brother, uncle, what have you, I think it's worth all of us as women as well having that conversation with men around the fact that this is an important part of their health and that if there are any issues, they should seek assistance.
Should and can be addressed.
Absolutely, yeah. So that's the first thing, is asking for assistance and going to see.
And often that's, sometimes can happen in our consults. It's the wife.
And so, yeah, absolutely. So I think the conversation needs to be started and then there needs to be a very good history taken around all those different factors and how far the sexual function goes back as well. Whether this goes back to pre-puberty, whether the man went through puberty at the same rate as his peers, because there are some familial and genetic or childhood issues that can affect sexual function. And then obviously working out what the symptoms are, so whether or not there's loss of nighttime and early morning erections, loss of strength of erection or hardness, whether there's any problem with arousal or libido, and then whether or not there's any problem with ejaculation. And that can be from early ejaculation through to delayed or even no ejaculation. So there are a whole lot of issues there that need to be addressed. And the healthcare provider also needs to make sure that they examine the person because obviously these issues can start, at the pituitary gland that I mentioned before or the brain, but they could also be an issue with the testicles or the penis itself. So there needs to be a full proper examination. Now, I might just add to there, if you feel uncomfortable as a man about having any kind of examination of your genitals, then please speak up because, as healthcare providers, we're all very, very understanding around people's privacy and any ideas they may have or fears or beliefs they may have around, parts of their body. whether that be the genitals or any other part. And so if you don't feel comfortable to have an examination, you just speak up, because we're used to hearing that. We're used to people saying to us, actually, I'd prefer that you didn't have a look. I'd prefer just to be able to tell you. And sometimes they may feel more comfortable with a male. Sometimes they may actually feel more comfortable with a female. So please don't be afraid or hesitant to make your thoughts known or your wishes known around that as well. Yeah. So then that leads into the discussion of, once we've had an idea of what might be going on, the kind of testing that needs to be done. And in general, we would do some hormonal tests, maybe some tests for sleep disorders, sleep apnea, restless legs. Sometimes we do need to do some imaging, so maybe an MRI of the brain pituitary. Sometimes we do ultrasounds of the testicles. So that's a fairly comprehensive assessment when it comes to the investigation side of things. And again, that will be individualised. So that will depend on what symptoms and signs someone is explaining when they talk about their sexual function issues. And then once we move from there, we can talk about the treatments, yeah? And so there's a whole range of treatments for men, and I think men are really lucky in this respect, that there are a lot more treatments for male sexual functional issues as opposed to women. In women now, we're just starting to get some treatments coming through. So in men, I think probably most men will have heard of Viagra, Cialis, Sildenafil, these kind of medications that open up the blood vessels in the penis and allow for erections and stronger erections and erections that last for longer. We need to be careful around using these medications in men who have heart conditions or in men who are taking some other cardiac medications or blood pressure medications, heart medications, and those generally are the nitrates. And, there's lots of different brand names for those, so they need to check. But also some of the prostate or blood pressure medications, such as Prazosin that I mentioned before, can also interfere with the Viagra, Sildenafil, Cialis type medications. So they absolutely need to know that they're going to be safe to take those. And then we do have different doses that we recommend. So we generally would recommend starting at a low dose and then increasing as needed. But that's a very nice, easy, effective medication. And we generally would suggest that that's taken about half an hour before it's required. And then obviously, if there's a hormonal issue, hopefully we will have addressed any underlying hormonal issues like an underactive thyroid or not enough testosterone. And we've got a lot of testosterone therapies now available to us, and they can often improve sexual function if the person is low in those hormones. Then once we've looked at those issues, we move on to the more physical types of methods.
So if correcting the hormones and if, opening up, the kind of the blood flow doesn't seem to be enough, then what would be the next step?
Yeah. So then the next step really is thinking about physical means. So I think a lot of men have probably heard of pumps or rings or injections, and they are easily accessed through your healthcare provider, and there are some what we call general practitioners or family doctors that specialise in these areas and run men's health clinics, and they provide a lot of really good advice around those and demonstrate how to use them, and that they can be very effective for men who don't respond to those what we call first line treatments. So they're really your second line treatments, and then beyond that we actually have surgery. So some men do have had some damage to their penile tissue, and that may well be a crooked organ. Now, a lot of men have never sought any kind of advice around that because I think it's not uncommon, and if it doesn't interfere with sexual function, then it's not something that men go to their practitioners about. But for some men, certainly any real deformity, because the penis has been damaged, can cause sexual dysfunction, and so we will often suggest surgery for those particular cases where there's a significant dysfunction related to the damage that has occurred. So that's kind of a reconstructive surgery, if you like. There are also penile implants now that are being provided, and Laura and I were discussing them just prior to recording this, and there are devices that are implanted surgically that then have a pump associated with them. There are also devices that are implanted surgically that are movable or malleable or shapeable, and so then you would manually shape that into whatever position you wanted the penis to be in. And I think there's going to be a lot more new devices and new treatments available in coming months and coming years. So there's a lot of options available to men in this area. Now, if there's an ejaculatory problem, then that needs to be addressed a little bit differently, and sometimes that will involve couples therapy, maybe some psychology or psychiatry intervention, sometimes ironically some antidepressant or anti-anxiety medication, which we've heard can sometimes affect sexual function adversely.
And how does that present?
The ejaculatory issue. So some men will tell you they think they're ejaculating too soon. A lot of men may also feel that they're ejaculating too late or struggling to ejaculate. Some men might not be able to ejaculate at all. Yeah. I might just add too, there are health conditions and surgeries that can interfere with ejaculation. So men who've had prostate surgery in particular, or any surgery in that region, may have some ejaculatory problems based around the fallout or the the sequelae of that surgery. So that can be an issue too. Yeah. So lots of treatments available, and I think the main thing here is starting the conversation. So if men can feel empowered to go to their healthcare providers and have this conversation, it's really important. And I think too, having that conversation with their partners. So I will often have wives come to, or other male partners come to consultations with their partner who is suffering from sexual function issues, and the conversation is actually started by the partner. And I've found those conversations sometimes the most helpful, because then you really can hear from both parties what's happening, but it's often the first time that they've even discussed it as a couple. And having someone else there to help them with that discussion
and facilitate that can be really powerful.
It can be incredibly helpful and reassuring, and so often I've had couples say, it was a really important part of their relationship and they really would like to reestablish that part of their relationship, and what can we do to help with that? But then I've also had couples say to me, you know what, we had an amazing sexual relationship previously, but now we've both moved on, and it can be just as empowering for that couple to say to one another, you know what, I actually don't feel like I need sex anymore, or I don't feel like I need that much anymore. And, these are the things I would like. I'd like, maybe some more intimacy in other areas or what have you. So that conversation can be really empowering in a lot of ways. Yeah.
Well, thank you, Merryn. I think there's a lot of people who would benefit from just kind of maybe having some words and some questions to ask, and knowing that you're not alone as a start. And there's a lot of really great treatments out there. So we definitely encourage you to speak to your local health practitioner and get the conversation going if this is affecting you or someone you know and love.
Thanks for joining us.
Thank you. And this is Your Health Now.